Good morning. We had a really busy weekend. On Saturday, I went to the funeral for Eric Stein, who was the deputy sheriff from Keokuk County, who was killed. And it was very moving. Tremendous outpouring of people, especially the law enforcement community. We had deputy sheriffs and police officers from all over Iowa and from several other states. Also Iowa Highway Patrol, and the community itself. Got the opportunity to visit with his father and grandparents and express condolences to people who left. Really outstanding young man. Great community servant who died in the line of service, and we haven't had that in Iowa since 1985. And I actually went to that funeral in 1985 as well, an officer that died in Newton, dealing with a robbery at a grocery store. And then, of course, we had the tornadoes that hit northwest Iowa over the weekend. It was not easy, but we did get to meet. First, we can't win in a Black Hawk helicopter with the National Guard and with Jerry Kill, our Director of Emergency Management and Homeland Security, and also with the Advocate General, Tim Moore, and the ceilings came, the fog came in, and we got within about 6 miles, 5 or 6 miles of it, and we had to turn around, and eventually we landed briefly in a cornfield near Ricketts, and then we went back to Fort Dodge and refueled. We got there in the afternoon. But I was just first of all, amazed that nobody died, considering the significant damage, the number of homes destroyed and businesses. But they had the warning system. They got a 15-minute warning, and most people were able to be in their basements. That made a real difference. The other thing is the resiliency of the people. By the time I was there in the afternoon, the cleanup was well underway, and you had all kinds of people. You had, of course, the Red Cross and the Salvation Army were there. You had state agencies like the DOT, but you had just a lot of citizens, surrounding communities, and all kinds of people came in with tractors and dump trucks and equipment of all kinds. And the devastation was tremendous, and rubble everywhere. But they had the streets cleaned. They were cleaning yards and helping people in their homes. A lot of friends and family were there. They did open a shelter for the people, but most people stayed with friends and relatives. Anyway, they're well underway with the cleanup, and I'm just really impressed with the way that everybody is working together, and certainly I think the local officials deserve a lot of credit for what they did to warn people, and then the work that went on in the community during the evening to make sure that everybody was okay, and then the cleanup seems to be well underway. But I've already declared Winona County, and then also we ended up, I think it was Pocahontas County also has been declared disaster area. There is damage in Sac County and Kasuth County as well, so there may be additional designations there. As of now, we haven't received those requests. I'll turn it over to the Lieutenant.
Thank you, Governor. Good morning. Today we're going to talk about the important topic of mental health reform. We have significant issues with the present delivery of services to individuals with intellectual disability and mental health conditions. We have 99 county plans rather than one consistent system of delivery. County investments and services are not consistent or equitable. We have disparity in access, service, levels of care, and quality. Essential services exist only in a few counties. Services are decided by legal settlement and by residency verification. We have a lack of community-based system of care, and the reliance on property tax is a big part of how we pay for mental health delivery services at this time.
We're not going to solve this, all of this in 1 year. It's going to take a thoughtful approach over a number of years. Already, we're spending $1.3 billion on these services in the state of Iowa, including federal, state, and local. These are critical services to Iowans that are vulnerable or in need. Iowa needs a consistent statewide mental health and developmental disability system that delivers quality care as close to home as possible. And it needs to secure the best outcomes for the people of our state. We've been working on this. I addressed this in my address to the General Assembly earlier in the year. Chuck Palmer, when he was appointed as the director of the Department of Human Services, I asked him if he would take the lead in trying to bring this together. And he's been working with the House and the Senate on this. I'm very hopeful that we can work out a balanced system that will provide access and do it in an affordable way, provide quality services, and do it in a way that is appropriate to meet the needs of the people of our state. We'll be glad to respond to your questions.
Have you seen the draft of what's being proposed?
Yes, we've been working with Chuck Palmer, and we've had several meetings with him over the last couple of months, and he's been working with both the House and the Senate. They have different ideas and whatever, but I think I have a lot of confidence in Chuck Palmer. I think he really understands this area and this subject, and I think he's got a plan. I would characterize it to be somewhat similar to the way we took on the state taking over the cost of the court system back in the 80s, where we took pieces of it each year, and over a 4-year period, the state was able to completely take over the cost of funding the court system from the property taxpayers at the local level and make it a statewide system. I think it worked very well, very seamlessly, and it was an affordable way to do things. And Chuck has come up with a plan that I think is very similar to that, which I think makes a lot of sense, and we're very hopeful we can get that approved.